A picture on the cover of the May 21st issue of Time magazine sparked more controversy and discussion over the pros and cons of breastfeeding. Public breastfeeding has also been a hot topic of debate online. Breastfeeding is the most natural way to feed a child, and this should be how it is viewed. According to the World Health Organization, breastfeeding is one of the most effective ways to ensure child health and survival. Optimal breastfeeding, together with complementary feeding, helps prevent malnutrition and can save up to 1 million child lives. The World Health Organization recommends exclusive breastfeeding for the first 6 months of life, and after 6 months, other foods should complement breastfeeding for up to 2 years. Breastfeeding in public places, many people say, is indecent and should not be allowed. Yet, in an article from the Huffington Post about attachment parenting, it says, "How can we shame women who are just following the advice of the country's foremost medical establishment?" The World Health Organization says that breastfeeding should be as often as a child wants, day and night, promoting healthy children and giving them the nourishment they need in order to grow to live a healthy life is any parent's goal. So when a mother is in a public place and her infant needs fed, should she be forced to leave what she is doing or where she is at to take herself and her baby to a private area where nobody can see them? This hassle for the mother can lead to the baby receiving less than it needs at that time, or maybe not being fed at all. Mothers should be able to breastfeed whenever their child needs it, regardless of where they're at. Infant formula seems like a good solution to the argument of breastfeeding in public, but there can be many risk factors involved when infant formula is not properly prepared. For many people in the United States, though, formula availability and preparation is very easy, but it should be up to the mother to decide whether or not she wishes to use the formula with her baby. Breast milk is the ideal food for babies. It gives these babies the nutrients they need to be healthy and protect against illness. Breastfeeding also contributes to a lifetime of good health benefits. It's adults who were breastfed as babies were shown to perform better on intelligence tests, have lower blood pressure, and lower cholesterol. There are also lower rates for obesity and type 2 diabetes in those who were fed breast milk. According to womenshealth.gov, breastfeeding is a better option because of the cost savings as well as the health benefits to both mother and baby. Breastfeeding can also help prevent type 2 diabetes in mothers, helping prevent breast cancer as well as ovarian cancer. Breastfeeding can also be easier and less stressful as there are no bottles to sterilize and no formula to measure. There are many good reasons for infants to be breastfed, and there are also conditions where formula works best for the mother and her child with their situation. What is important to remember is that it is the choice of the mother and her doctor. So next time the debate comes up about public breastfeeding, remember the health benefits that can be gained for both mother and child from breastfeeding, as it is the healthiest, most natural way for a baby to live a healthy, happy life.